How to pick a good Botox injection doctor. In the United States, more than 3.5 million men and women had cosmetic botulinum Botox injections in 2013. 1. Botox injections temporarily paralyze or reduce muscle contractions in order to reduce the appearance of facial wrinkles, treat neck spasms and reduce excessive sweating. Botox was the first drug to use botulinum toxin, although there are a variety of other similar drugs available now: Dysport, Myablock, Xeomin. Finding a qualified and compatible doctor to give you a Botox injection is important so that you feel comfortable and minimize the risk of any side effects. Choosing a doctor. Choose a dermatologist. The best way to minimize your risks, enhance your experience and get the best results from Botox injections is by choosing a qualified and experienced doctor. Dermatologists are experts at treating a wide variety of skin problems and cosmetic concerns for the face, so your search should start within this group of specialists. If you're getting Botox injections for neck spasms or a lazy eye, then you can expand your search to include other types of doctors, such as orthopedists and ophthalmologists, although your family physician might be very experienced also. Make a list of qualified doctors in your area. Using the Internet or Yellow Pages, make a list of about a dozen or so qualified doctors in your area who work in established clinics and advertise that they offer Botox injections. Call their offices and ask if they have a background in cosmetic medicine, as well as training and experience administering botulinum toxin injections. If you are getting injections into your facial muscles, you need a doctor who has specialized training in facial anatomy and a well-developed aesthetic eye. Most family practitioners don't have these skills, so ask around. Give some preference to Botox doctors who come recommended from family members or close friends. If their experience was positive, there is a good chance yours will be also. Research their professional records. Once you have your list narrowed down to under 10 potential doctors, spend a few hours researching their names on the Internet, particularly their state medical boards and associations. In some cases, otherwise good doctors have to deal with and settle frivolous lawsuits that don't reflect their competence. As such, talk to the doctor on the phone and ask them about the case. A doctor with a clean record doesn't mean they are competent or experienced with Botox, just that they likely haven't been grossly negligent and endangered someone's life. Look up testimonials and reviews online. Another way to find out information about doctors is to read reviews, testimonials and comments made online by previous patients. Stick to the information about Botox injections and not other procedures performed by the doctor. Decide if the balance of comments are positive or negative, and eliminate any candidates that have more than a few bad or scathing reviews. Botox therapy can be dangerous if it's administered incorrectly, so there can be legitimate complaints by patients and not just petty cosmetic concerns. 5. Keep in mind that most people tend to take the time to write something online only if they are really angry or disappointed, which can bias the reviews. Satisfied and happy people don't frequently write reviews online. Make an appointment and interview them. Once your list is at a more manageable number of qualified and experienced doctors, 6 or less, it's time to make an appointment and see them for a consultation. Ask for a tour of the office and get a feel for the doctor's demeanor and professionalism. Eliminate doctors from your list who seem too busy, distracted, rude or are too pushy and money-focused. Ask the doctor to see samples of their work, such as authorized before and after photos of their Botox patients. 6. Ask who actually does the injection. If a registered nurse or physician's assistant does the injection, that may be fine, but they should be working closely under the doctor's supervision. Compare prices and dose strengths. Botox injections are the most commonly performed cosmetic procedure in the world, so competition can be fierce and prices are more affordable than ever. Ask if you get a discount for referring other people or coming in with a friend or spouse. Don't always choose the cheapest fee. Balance it against your gut feeling of the doctor, their staff and the facility. Make an appointment for the procedure. Once you've narrowed it down to your top choice, find out if they can accommodate your schedule and time frame. Most highly recommended and reasonably priced doctors have long waiting lists for Botox injections, which may not suit you. Whoever you pick has to be able to fit you in, so keep an alternate doctor in mind in case there's scheduling conflicts. Hours of operation is also an issue. Established clinics with successful doctors often have shorter hours and aren't open on weekends. Make sure your doctor's availability suits you. Newer clinics and less experienced doctors are often open more days and have more flexible hours, but they might not have had time to build a good reputation in the community.